Good morning, everybody.
Good morning, Michael.
Well, first of all, welcome to our board meeting in Newcastle. Newcastle is a very important location for the CQC because this is where we have a very large number of colleagues who work in our customer service centre, many of them taking the very large number of calls that come to the CQC daily with concerns of various kinds, and it's very important for us to hear those concerns. But we also have colleagues who run the finance, or at least are part of the finance function at CQC, HR, and other very important parts of the organisation. So, as I say, Newcastle is an important location for us. Unfortunately, there are 4 non-executive directors who can't be with us today for a variety of reasons. They're either not in the country. One of them, unfortunately, was taken ill yesterday. So we're a rather smaller group, but I hope this means we can have a even more thorough discussion of the papers that are here. And some of them, like our Q2 performance report, are very important. Now, I'm sort of omni-channel today because I've got my board pad and the papers. So the trouble with being omni-channel is you're not quite sure whether to go totally digital or stick with the paper. And so I'm probably going to get rather confused about whether I'm looking at my iPad or looking at the board pad on my iPad or looking at the papers. But so apologies if that causes any problems. But first of all, the minutes of our last board meeting. I don't know if colleagues have any comments on the minutes or whether we can take them as read and approved. I think we can take them as read. There was only one action point or matters arising. In fact, I can't even remember that this did arise at our last board meeting, but it's a discussion we're about to have, or David probably is, and Eileen are about to have with our colleagues who are members of trades unions. But that's not for. We're not going to be discussing that today. So I think we can go straight to the CEO report. Just one other timetabling change. We were at 10 o'clock going to go over to the NCSC to listen in to some calls, but various directors have commitments to catch early trains, and so we're going to delay this to sometime, perhaps in the spring, because Eileen, as I said earlier, pointed out it's not just the call centre. There's a number of other important functions, and that we really need to give justice to a visit to our Newcastle location. So, perhaps in the spring we'll arrange a board meeting which allows us to spend, at least a couple of hours over there, so all colleagues, in addition to their induction, get a very good understanding of what happens at Newcastle. So, David, your CEO report, please.
Thanks, Michael. Good morning, everybody. So I don't intend to dwell on the Chief Executive's report. So much of it is about performance, and the main item this morning is about performance. So I think there's far more detail on our progress and performance in the performance report rather than in my report. So if you allow me to gloss over that, those aspects of the report which are about performance, because we'll have a more substantial discussion on the next item. And I'll just pull out 2 or 3 things. So on page 3 of the report, there's an update on the provider portal for registration, which is an important development of the progress that's being made to improve how we register services. That's re-registrations, changes to registrations and new registrations using a digital provided portal. We're making increasing progress in the rollout of a digital portal with increasing amounts of business being transacted digitally, which is a more efficient as well as a more effective use of time, both for people that are making applications and for CQC staff. So that proceeds, and it's a cross-CQC effort that Andrew is overseeing through the Registration Programme Board. Next item I'd go to is just towards the end, Michael, is just to review where we are on publications and accountability through the Public Accounts Committee. I think executive and non-executive colleagues are familiar with all of these, but these documents are currently out for consultation and discussion, and those discussions continue to progress. Last thing I just want to mention, particularly in a public forum, is that the Secretary of State yesterday early evening published his letter to the Health Select Committee announcing that Peter Wyman was his preferred choice as successor to David Pryor, Lord Pryor, as chair. So I think that will now go out, will be in the public domain, and Peter will appear before the Health Select Committee. I think it's on the 1st of December for a confirmation hearing, which is why any announcement is subject to that confirmation hearing and is described as a preferred choice. So, but that's the biggest item of update news since this report was drafted. So if I just pause there, as I say, I'm not going to cover how many inspections have been done and what progress is being made, because that's, I think, covered in more substance in the performance report itself.
Can I just ask one question, which is about inspections, but I don't think necessarily about the performance aspect. I noticed the good news that special measures general practice has been removed out of that, and improvements are made. And I just wonder, when that happens, do we, both on our behalf and indeed on behalf of a practice that has successfully turned itself around, do enough to communicate, firstly, that's happened, because it must be pretty dreadful being in special measures in a general practice in relation, as far as relations with the patients are concerned, and to use the opportunity from both sides really to demonstrate how the process is constructive and effective rather than something to be feared.
Thank you, Robert. It's a very good point. We about 50% so far of those who've been in special measures have improved. On one occasion, due to takeover by the local acute trust. We carefully put out a press release and talk about this, but the press aren't as keen, I think, to publish the good news stories as they are about the problems, and that's one of our difficulties all the way through. But we're trying to collate more examples of this happening, and it's part of our strategy is to try and communicate that more effectively. At the moment, we've only had 5 or 6 of these practices, so it's small numbers. There are lessons in all of them, and what we need to do is get that out. What we would hope is that the leaders of the GP bodies, the BMA and the college would also help us communicate the good news and also share outstanding practice. We live in hope.
I mean, it does strike me that it's not just a matter of communicating with the public and patients, although that is extremely important. It's also a question, as implied by that, of communication with other practitioners and registered providers, so that the process is understood. Because it does seem to me, particularly in relation to people who, as it were, running their own businesses, that this sort of process must be potentially generate fear, which is not constructive for anyone, let alone the patient. And if it's seen not to be necessarily a stigma, which is, that's how people will often feel it, I think, but actually part of a process which is to be welcomed, because this is, generally speaking, what happens when it goes right, that there will be a developing understanding amongst the profession that this is, and you can see that, I think, from some of the feedback you put in your reports from people who are surprised, pleasantly surprised at how it's all gone. And it does seem to me that it perhaps is worth just looking at a bit, because, as you rightly imply, there is a lot of ill-informed fear about that.
If I could come back on that, it's exactly what we're trying to do. So on Monday night, I was at a big meeting of GPs talking just about this sort of issue, and it was hugely constructive, the feedback from the audience. The contentious issue was about fees. It wasn't about the inspection. And for those, we've just done a big survey of practices, and it's overwhelmingly positive once they've been inspected. And you're right, it's about special measures in primary care, particularly about improvement. It's not about getting rid of the practice, as the sort of phrase is being used. Unfortunately, there are some practices which are so bad that we are having to go to court. We've been in court every day this week and Friday on one case, which is extremely time-consuming. What we're hoping is that, and we're seeing this, that it's not just people in special measures that improve, but we think that because we're around and they know we're coming in to inspect, that practices are better than they would have been without us. And that's borne out based on the fundamental standards, the basic standards we had during the pilot. We're not finding 30% of the practices fail on the basic standards anymore. Practices are much better than they were 18 months ago. But perhaps the message of improvement gets drowned out a bit from the criticism. So it's really helpful. Thank you very much.
The other thing, just to add to that, I'm meeting Chris Day, who's our Director of Communication, on Monday, because I think we do need to think about how some of the key messages around where change has been affected and improvements have been made, how we land those. And I think to Steve's point, all these are press release, but the amount of penetration that coverage gets is far less than when we say something's gone into special measures. So I think we just need to think differently about how we get some of those messages across around our impact, because I think it is clear from the State of Care report and from the case that you're pulling out, Robert, that improvements are being made, and I think we need to play our part in drawing those to people's attention as well. Otherwise, what people have is an impression that things are not satisfactory, services are inadequate and require improvement, but where that improvement is made, there's less awareness of that. So I think we need to think critically about what more we can do in relation to that. I know chief inspectors do this from platforms and conferences and in meetings they go to, but I'm not sure that penetrates the national media in any way, shape or form, quite frankly. Hospital does a good job, regulator does a good job, is never a news story. Hospital doesn't do a good job, regulator doesn't do a good job is a news story. And actually, to your point about how people can be informed of quality and safety in services is a key issue that we need to.
I wonder whether perhaps there obviously has to be some distance in one sense between us as a regulator and those we regulate, but in these circumstances, whether there is some more perhaps joint programme of communication or action that could be thought about between us and the provider, because just to show that we're all in this together in that regard, in a way which perhaps might penetrate a little more, even if only locally, actually, than perhaps happens at the moment.
And the press that matters if you're running a small business is the local press. And actually, as a national regulator, we sort of miss that a bit. And if you think about Ofsted as an example, Ofsted and the local school communicate by putting banners outside the school, which is really very local and works very well. You know, we now are good, and we were inadequate, you see all over the place. And I think probably Chris needs to go and talk to Ofsted about how you generate relationships with, you can get to most local papers, and they are interested in an improvement story in the way in which national papers are not interested in improvement stories.
Could I just say, actually, we have been doing some proactive work around that, and particular pay tribute to Chris's team around this, because we, from an adult social care point of view, we had been producing press releases around the outstandings and the inadequates, and not press releasing others. And we weren't getting, exactly as you say, Paul, we weren't getting the response to that from a local press perspective. So from the 1st of April this year, we've been producing the information on a weekly basis, broken down by local authority areas, sending that out from the regional press contacts to the local press, and highlighting in that all of the reports that we published in the previous week. And with that just one simple change of approach, the numbers of reports that we've had, and you're quite right, it's the local press that do this, the numbers of reports that we've had of the good services that we've rated, not just the outstanding but the good as well, has massively increased. And again, we're also encouraging providers who are now from the 1st of April expected to publish their ratings and display them in public areas and services to make more of that. And I think we are seeing that in that trend. So, you know, Chris, I'm sure, has been talking to others and learning from others, but that's just one example.
Paul.
Yeah, that's very helpful, Andrea. So to give a sense of how this works, there are broadly 4 ways that we look to reach different constituencies. So there's a whole set of media involvement and engagement, and Andrew's laid out how that's developed over the course of time. Then there's the direct provider engagement. So behind the scenes, there are a whole series of open forums, there are newsletters where we have ongoing engagement with all the different sectors that we regulate, and that allows them to hear the messages unfiltered, if you like. It's worth saying, certainly, when we look at our news stories, which are both local and national, the significant majority of news stories are positive about the work that we're doing. That doesn't mean that all of them are, and that doesn't mean there isn't room for us to improve, but it is an important sort of fact. Then there is all the work that we do with parliamentary stakeholders, or particularly important as local representatives. And quite often, of course, the local papers will want to understand what the MP's perspective is, so we would always let MPs know of all of Inspector Reports, particularly important issues like coming out of special measures. And then one of the other challenges, particularly important, of course, is our internal communication, so that our staff know. So one of the things that I know, for example, Steve does every week, and Andrew as well, and lots of us, is put out weekly messages about what we're learning, what we've found, what the different ratings are if people have come out of special measures, so that our inspectors, as they're out and about, can also be getting that message across to providers about the value that's being added and the encouraging improvement. So I think there's quite a lot going on, which isn't to say that we can't learn from others as well.
Thank you, Paul. I think Lewis has written a note, but I maybe, I think it was Lewis, who suggested with, in the case of care homes, I don't know if he copied Andrea on this email, that we should actually write to each resident or their relatives about the results of our inspections. Now, I replied to Lewis that this, you know, in principle was an interesting idea, but and an important idea, but the problem is that if we write to a relative or a patient saying their home has been rated inadequate, what are we expecting them to do? I mean, are we expecting them to move? It's quite a dilemma. It's, you know, reporting good news is, you know, by definition, much easier than reporting difficult news, because then are we asking people to take a decision as a result? I don't know. It'd be interesting to know from Ofsted whether parents actually move children when a school, assuming places are available at other schools, move children as a result of their equivalent of inadequates. But so This has been raised. Andrea.
Yes, and forgive me because I haven't responded to that email and I should have done, because we considered this in the development of the new methodology and consulted on it. And what we say in the provider handbook is that the summary that we write at the beginning of the care both for domiciliary care and for care homes services, we are expecting the provider to use that summary as the basis of communication to the people who are using the service, but also relatives and families if that's appropriate. Obviously it depends on the nature of the service. And what I wanted to do was to follow up with the team to see how confident are we that that is actually happening. It's there in the provider handbook as an expectation, but I don't know whether we've kind of proactively checked that that is happening across the board. But it was exactly for the reason that Lewis identified, that we wanted to make people aware. And the reason for asking the providers to do it, because that is indeed what Ofsted do, is they ask the school to send the information out to parents. The reason for asking the provider to do it is A, because they've got the details and the contact details to be able to, and secondly, because it would then allow them, if it was an inadequate or requires improvement service, for them to add information into that communication about what they're doing about it. And again, certainly when I've talked to people about the display of ratings and their concern about displaying inadequate or requires improvement, like put something up next to it that says what you're doing about it, to give people reassurance that actually you've got insight, you are taking the action that's required, rather than just saying it's inadequate and kind of leaving it at that. So those things are in play.
And I think that's the right place to locate it, isn't it? Because if I received a letter saying that my mum was in a place that was inadequate from CQC, I'd write back and say, and what do you want me to do? Whereas if I receive it from a provider, then I write back and say, and what are you doing? And so I think it's locating the letter and the communication in the right place. And we have to be better at talking to the public rather than to individuals. But I think individuals have got to work out their future and their loved ones' future with the providers.
No, that's an excellent discussion. If we can now move on to our performance report. David, are you going to take us through that?
Yeah, well, so Michael, what I'll do, if I present the report at a high level, and then I think Andrea, Steve and Mike are on standby to come in on some of the issues about what we're doing, particularly in those areas for development, what action they've got in place. So if I go first, and then, which is a kinder way of saying I'll do the presentation and they can answer all the difficult questions, but effectively that's what we'll do. So first thing I'd like to do, Michael, and again, just to pick up on your point about just how many colleagues CQC does have in Newcastle, is just pay tribute to colleagues in the recruitment section who set out at the beginning of this year to secure 600 additional inspectors, and a number of us were in there briefly yesterday where I've never seen balloons up that spell out 600 before, but there's balloons up in the recruitment section celebrating the fact that at the end of October they'd got to 600, which I think is a tremendous achievement. And I think, was it 631 or was it 600? Anyway, 13. I'll rearrange these in any... but anyway, they've done that, and I'd like to pay tribute to them. And Nicola Evans, who's led that team, I think deserves special commendation for what she's managed to achieve and the leadership that she's given it. So important to pay tribute to those colleagues for, by our own definitions of what I think will be quite outstanding work. So I'd like to do that. This report is flagging 5 areas for discussion and development, and I'll go through each one very briefly, if I may, Michael. So on the comprehensive inspections, I think we've made good progress in relation to this. We continue to roll this out and rate services, and we are seeing an increase in highest proportion of good and outstanding ratings in caring, and the highest proportion of requires improvement ratings in the safe area. But what we've not drawn attention to as much previously, coming on to this issue about our impact, is that in adult social care, 44% had improved their rating on re-inspection. 25% of hospitals had improved on re-inspection, and 86% for primary medical services. So this speaks to the point, I think, that Robert was flagging of where we do go back and re-inspect. Improvements are noticeable and evident in the way that we rate those services. We've placed 164 locations into special measures in the second quarter, and they're being tracked, and we'll re-inspect those after 6 months in order to check that improvements are indeed being made. On our reporting, and I think this is an issue that we flag in the main report, 59% of our final reports were published within 50 days in quarter two, and that's an improvement from the 44% that were published within that same time period in quarter one. So an example, I think, of improvements that are indeed being made. And one of the themes during this year in relation to inspections is our work on safeguarding, and Sally Warren has been overseeing some work through the Safeguarding Committee to improve our performance, and the improved reporting data is contained in this report, and I think this is now on a much more stable platform with our performance improving just in terms of the number of alerts which are flagged to local authorities within 1 day is now exceeding the target that has been set. So all examples of good progress that are being made. Areas for development, and this is perhaps something that the board might want to discuss, and my Chief Inspector colleagues are prepared for questions on this, is in relation to just where we are in terms of the inspection programme. We considered this in detail at the last meeting, and the actions are set out that are being taken in 3.3 of the covering report, and then in the detail of the performance report itself. So I'd like to present the comprehensive inspections as good progress being made while still further work to be undertaken. Going back to the Public Accounts Committee, I think the re-inspections and the improvements after a re-inspection are some evidence of the impact that we're making, and hence effectiveness. Second area is around data quality and the completion of CRM. I think we continue to press this issue within the organisation, and I think improvements are taking place. A critical issue here is that we are dependent on data to actually manage the organisation and be able to chart our performance, and effectively that means that reporting is made in real time into the customer relationship database, which allows us to be clear about what progress we are making, and we can do that in, as I say, in real time. So we continue to press on that. Publication of inspection reports. We do continue to make progress in relation to this, particularly in adult social care and primary medical services, which are they're not easier reports, but they are simpler reports to produce. They still need producing and to a standard. I think in hospitals these are much more complicated affairs with more people making a contribution, and there's further work to be done in relation to that. Next area is locations not meeting one or more standards. This is page 12 in the performance report, and again what the report sets out is some of the actions which are being taken across the 3 inspection directorates, and again Mike, Andrea and Steve are prepared to say more about what work they're undertaking to drive improvements in that area. I've touched briefly on safeguarding, but just to the risk of repeating myself, I think there's been a very effective piece of review work carried out over the past few months, and that's now bearing fruit with improved performance in the way that we are responding to safeguarding both concerns and alerts. And I personally feel much more confident as a consequence of that review work in relation to that material, that information, that intelligence being processed both in a timely manner but also in an appropriate manner as that works its way through. So I think they're the 5 key areas that we've flagged in the covering report, Michael. The report also, in its detail, touches on our financial performance, and you'll see that we're projecting an underspend towards the end of the financial year of just over £6 million. That is the report at the end of, I think it's at the end of September, and we continue to monitor that performance on finance. And then the last item just to mention is in relation to the strategic risk register, which occasionally in our conversations we focus heavily on our performance, but the risk register is an important tool that I know that Paul Rue, through the Audit and Risk Committee, spends time considering. It also comes to the executive team, and we continue to update that on a regular basis, and that flags some of the risks that are there. But perhaps, Michael, if I pause there, and if colleagues have questions, then between myself and the executive team, not just the chief inspectors, will endeavour to answer those questions.
Thank you, David. I should just say that Jennifer sent me an email about the points she would like discussed at the board meeting. And as far as the performance report was concerned, there were 2 main areas, both of which David has touched on. One is the plans to get closer to our targets on inspections. And the other one, which I also felt was an important point, is the number of locations where there is still a degree of non-compliance after 12 months. So those were Jennifer's 2 points, and perhaps we could take each of those in turn. So it would be very helpful, I think, if the chief inspectors could, first of all, take us through their plans to, although it's called improved performance, it's really the plans for getting on to a better trajectory for our, I think we call them our first ratings inspections. So just going down the table, as there's no logic in this order except where people are sitting. Mike, would you like to start just by explaining?
The shock has knocked my name off.
Yes.
And yes, certainly. I think in terms of comprehensive inspections, barring problems related to winter pressures or anything that might prevent us from doing inspections over the next 4 months, we are on track to do all the acute trusts with A&E departments by the end of March, and then all the other trusts, including specialist trusts, mental health and community trusts, and indeed the ambulance trusts, by the end of June. So I think we will get to that target. The constraint on us has been the amount of re-inspection that we have had to be doing, and that is because we have found more trusts to require improvement or to be inadequate than we had anticipated, and we have to go back to those because those are ones we know where there are substantial risks, and that at the moment, what that has done is meant that we are later starting in earnest our programme of inspections of independent hospitals, but we have now done some of those, and we will be doing those obviously in the latter part of 2016 in the main. So that's us on inspections. Do you want me to go on to non-compliance?
Well, I think we'll take that separately.
Take that separately.
So, Steve, on the PMS trajectory, please.
Put the speaker on. The context behind this is there are over 20,000 locations, and the report focuses mainly on the trajectory for general medical practice. So I think it's important to note we're on schedule for our dental target, which is 10% of the 11,500 dental inspections by April. And in order to help meet the GP target, we can profile the dentist to help us focus inspectors on general practice. But of course, the two big issues are recruitment and the quicker we get inspectors to be doing inspections, and then productivity. So on recruitment, the recruitment is going well now. It took a long time to get the inspectors in, but in London particularly, we've had a rush of people wanting to become inspectors. But as of yesterday, for example, in London, there are 38 inspectors in post, but 14 of those are still on induction and aren't actually actively inspecting. So when we look at productivity figures, they look lower than we wanted, which is about 8 a quarter. But the figures include those that are on induction as well. So on the ones that are actually inspecting, the productivity has improved in London dramatically. It's up where we want it to be at the moment. But London is where the major lag is on recruitment. Between now and the target date also depends very strongly on the use of our bank inspectors, who are doing a large number of inspectors for us, as well as flexing if they're reaching their productivity targets over time and whatever. A problem comes, of course, if the financial situation changes and we can't use bank inspectors after April. That will certainly cause a problem in meeting the targets. The rest of the focus is on how do you improve the productivity by reducing the sort of things that can be removed from the frontline inspector's job. And a number of these things include registration inquiries, supporting, getting better business support to try and help them become more effective. So we need a cross-CQC support there. And then there are sort of more medium to long-term things, including pre-populated reports. So it's about productivity, recruitment, and while you do that and we get the inspections done, we're also showing, because we've introduced a new smaller report, a shorter report to complete, the time to publication is also improving. And over the last 3 months, 75% on a rolling 3-month basis have met the KPI, rather than the 40-odd% which is in the monthly on the board report. So actually we've seen the seeds of improvement on trajectory, but they're not showing yet on the figures in the board reports.
Thank you. Andrea.
Thank you very much. So some of this is repetition of what both Mike and Steve had said, because the issues affect all three directorates. So again, we had anticipated a level of recruitment in terms of people able to go out and do inspections at the level of productivity that we were wanting. Earlier than has actually been the case. And I think Dave is absolutely right to pay tribute to the recruitment team for the support that they've given us in getting to the position that we have done. But there's also been a tremendous amount of work from inspection managers and heads of inspection to support that process as well, which has been very, very important. But we're ending up still at the end of this quarter just being shy of the numbers that we wanted to have in post by the end of this calendar year. But we've made good progress. So that has caused a dip in the start of the year, and we will start to progress up. So as Steve said, recruitment is a focus. The second area is also making sure that we're equipping and supporting our inspectors to do the job as well as they possibly can do, both in terms of productivity of getting through inspections, but also in terms of producing timely reports. And so we have been looking at that both in terms of the capability and performance of inspectors, identifying specific needs that they've got and trying to address those needs. So report writing has been one particular area, and we've seen some success and positive progress in that respect as well. Looking at streamlining some of the processes, so we have tried to cut out some of the levels of checking that we've had in our quality assurance process to speed that side of things up, and we're looking to make further improvements to that next year as well. And the Continuous Improvement Group led by Debbie Westhead is continuing to work with colleagues across CQC to look at other ways that we can streamline the process and use people better. So there's a sort of overarching kind of trying to improve productivity with the staff that we've got. We're also looking at how we make best use of the resources that we have, and from October onwards have set very clear criteria for the use of overtime to make sure that we can do additional inspections, and there has been some take-up of that, not huge, but some take-up of that, which has given us extra capacity. We've also been looking at the use of bank inspectors and making sure that that we're using them as second inspectors on inspections for the larger locations that we've got, or the areas that we've got concerns. And there are a small number of bank inspectors who potentially could lead inspections for us because they have been our staff, they have been properly trained, but we're not routinely using them to do that. So that's how we're trying to increase the capacity as well as the capability and performance. We continue to have, as a proportion of our inspection activity, an increasing amount of enforcement, which, as colleagues have said, is very time-consuming. It's clearly absolutely essential that we do that, and we will continue to do that. So I can see, in terms of the monthly monitoring that we're doing, that little by little we are kind of clawing back on the backlog. That will ramp up. I think that we will be there or thereabouts around the end of September next year. It will be incredibly challenging to actually hit September, but I don't think we will be far off, and there will certainly be some areas of the country that will complete their comprehensive inspection programme ahead of that schedule. And one of the other things that we're looking at is trying to make sure that we can utilise them to support colleagues elsewhere in the country to complete their programmes as well. So there's a raft of different things, but I wouldn't want you to think that it's all completely sorted because there's all sorts of things that could happen between now and this time next year. But we are managing and monitoring it very, very carefully. And there's huge commitment within the team to do it. I think that's another thing to say.
Thank you very much. I mean, this is such an important issue because, of course, anybody who listened in or watched the Public Accounts Committee, this really was the, although it was ostensibly about the NAO report, it really became a session about our ability to meet targets. I mean, there was one positive, which is one of the committee members actually suggested the CQC needs more resources. So whether anybody's going to listen to that comment is a separate point. But really there was one particular member of the committee, Mr. Phillips, who I think must have mentioned this. I don't know if it was 20 times, but it certainly felt that this was the most serious issue about the CQC's performance. So, colleagues around the table, comments on what we've heard from the Chief Inspectors. Robert.
Well, firstly, it's absolutely clear that we have a lot of inspectors doing incredibly hard work. And to the extent perhaps one might actually express worry about that, because if we put alongside what we see about not meeting targets on page 16 with what is being said about staff morale, I'm sure the two things are potentially linked, and communication and so on. So, firstly, tribute to the staff and everyone who's trying to do this. And I hear absolutely what's being said is encouraging about mitigating this, but are the figures telling us, forgive me if I'm wrong, but what seems to be, I'm being told at page 16, is that we're getting further and further away from the target rather than closer to it? Question one, am I wrong about that? And secondly, I notice, and I'm not sure what the significance of it is, that it said that the trajectory line has been removed from this month's reporting, and I'm not sure what that's about. So what I'm hearing is lots of really committed work being done about mitigating this, but what I'm not entirely sure, as I've heard, is what there is there that assures us that we are actually going to do what we've said we're going to do. Now, if we're not going to be able to do what we said we're going to do, well, I can understand we have the reasons there as to why that's a problem, but does that require us in any way to readjust our thinking about this, or do we just carry on and hope? That's my question, really, rather a long one.
David.
Well, let me have a go. And let me have a go, and colleagues may come in, and Paul might pick up on the just the changing convention about reporting and why we're doing that. So I think last month, Robert, we said, and I said that there was a risk that by September of next year we'd undershoot on the trajectory on PMS and adult social care by 7 and 8%, and that what we were doing, and this picks up on your point about the connection between morale, workload, and how we get to, if possible, close the gap. I think what staff have told us loud and clear is that any plan needs to be credible, it needs to be realistic and deliverable. And I think the easiest thing to have done is to have come into these meetings and said, we'll do it. And actually, I think that would have been less than honest if we'd have said that, because there's no point in over-promising publicly in a board meeting and then under-delivering because we've not been able to deliver it, knowing that what we were asking staff to do was unrealistic. So I think what we've tried to do in this report is be very honest and straight about it. And I think what chief inspectors have outlined, and certainly this has taken a prime time in our executive team meetings, is what is it that we need to do to close the gap. And I think all three of my colleagues have said what work is being put in place, and but there is still a risk, I think, and it would be wrong for us to pretend that we're going to get there very clearly and overshoot that target. I think what we are doing is working very hard to get to that target. We are mitigating. But the staff survey which we published, and again we report here, and there's detail in the performance report quite properly, is showing that we have made progress as an organisation on the staff survey. There's a lot to be very pleased about in that staff survey. But morale is still an issue. And I think this issue between people's personal morale, which is high and is increased, and organisational morale, I would reflect that the organisational morale is really about workloads and this issue about targets. So what I think we're trying to do as a senior team is strike a balance between motivating and inspiring people and not asking them to do the impossible. I think we are asking them to do the difficult, but not the impossible, and trying to get to a position where we can deliver what we've publicly set out and committed to deliver. So I don't think we're just carrying on. I think we'll continue to work hard, and I think Andrea, Mike and Steve have set out what they're doing. Paul and Eileen's teams also work to support that. That's a whole point about championing the recruitment activity that's gone on. So I think as an organisation we are focused on that. I think there's more that we need to do. So I hope that just gives an explanation of, in answer to your question. But we are, just to come to what I think is your key point, Robert, trying to strike a balance between doing what we've set out to do and actually trying to support staff to do it and to do the job that we're asking them to do. I don't want to give false assurance. I think this is going to be very tight as we go through the remainder of this financial year and into the next financial year. What is clear, though, is those new staff come into the organisation and begin to go through their induction and role-specific training and begin to pick up on taking their role forward. We do have more capacity and we can take this work forward. I think we probably had 45 minutes on this yesterday about what are the improvements in our systems and processes. How can we improve the way we produce and draft reports? A huge amount of time goes into reports. That's the drafting of reports, and then if there's factual accuracy tests, checks, if there's requests for ratings, reviews, that activity spends a huge amount of time. So I think what we have become increasingly clear on as a senior team is focusing on that and making that as efficient a process as we can is likely to free up a significant proportion of time, which will help. So I think I've been focused on getting more people into the organisation and then ensuring that they've got the skills to do the job. There's an awful lot of activity now going on in terms of efficiency. I think you're right. I read those figures in exactly the same way as you do. The gap between what we've done and the numbers that we should be doing has increased. I think this is why it was important that we were able to have more time on what action is being put in place to improve those. I would want to see at the next monthly report that we bring, so they won't be the quarterly report, but the monthly report, that we have some evidence that that gap is closing in the next report. We will be judged on what we do, on not what we say. So that will be the acid test, quite frankly, that we begin to close that gap. Do you want to say something just about the slightly different convention for reporting this?
So we have changed the look and feel of these. The big change we've tried to do is firstly to make sure that there's the picture extends out all the way to the end of the baselining period, and within that to show what the actual in-month position looks like. If you remember some previous charts, it became quite difficult to see what the in-month position was because it was always a cumulative target. So what page 16 and 17 are now doing in those bars and blue lines is just showing month by month, as well as the productivity where we have it in the in their text at the bottom. But just a couple of things to add to what chief inspectors have been saying. It does obviously take time as people come on board, and the recruitment's been so successful. We have a lot of new people. We have to get them up to speed, and we have to do that well so that they are regulating at the same high quality. But there is also a multiplier effect that if we have a team that isn't fully staffed, the first thing that any team must do is respond to concerns, and particularly urgent concerns, and that can take quite a lot of a team's time up. That's a sort of bedrock of what each team is constantly focused on. The more capacity there then is in each team allows quite a multiplier, because the number of providers doesn't particularly change, the number of concerns doesn't particularly change. That those additional inspectors are able to share the load of the inspection over and above that, so that bedrock of concerns activity. So that's why I think colleagues and the chief inspectors are raising we would expect to see an increase in productivity coming as we get our new inspectors on board and they become fully trained up. So Robert's having sounds absolutely the right one. We don't see the salmon bars increasing in size yet, but we do have a series of actions in place which should increase them, and I think the question for us is to keep tracking it as an executive team and at the board on a month or even within the month to see those numbers move.
Sorry, do we have I understand the difficulties of forecasting and all that, particularly about something as unquantifiable as how many concerns anyone's got to deal with, and one can perhaps overanalyse things. But is there somewhere a sort of forward-look analysis which says, well, actually, the way in which we are going to get to where we hope to get to is by this, and that's demonstrably it actually works. In other words, we have enough man-hours. We'll have enough man-hours to actually achieve what we set out to achieve, or if things stay as they are, or are we still in the position of, because we've got so much immediate and urgent work to do the inspections going back, and we just don't know how that's going to pan out. Which of those two situations are we in?
Shall I respond to that? I know Constantine wants to come in, but if I respond to that briefly, we absolutely do.
I do, because it was in a very related point. Is that all right? Just on the question of forecasting, because I think that's a really important, the really important thing. So it seems to me that as a board, there are three things that we need to do in relation to this kind of issue. One is to agree with the exec. The target will be set at the beginning of the year. The second is to reflect on the performance of the organisation and to be confident that you're doing everything you can if we're falling behind the target. And you know, although hearing all of the detail that you are obviously agonising over on a regular basis is kind of gives us that assurance, I'm not sure that certainly I can add very much to the sum of actions that you might be seeking to take. It feels to me like the executive have got their eyes absolutely over this and are taking the action that you can in order to redress it. So that seems to me to be kind of, you know, job done, and I'm not sure what we can add to that. But what we also have as a board is a responsibility for thinking about the reputational damage should we not hit targets that we've been involved in setting. And it seems to me that that's where the question of forecast comes in, because what I'm hearing from what I read into the reports and the data is that actually we probably won't hit the target, at least in adult social care and primary medical services now. And there's a question, so at what point do we say we're not going to hit it, and there are good reasons why we're not going to hit it, and this is how we're going to address it sort of beyond this immediate reporting period, because reputationally there's only one thing worse than not hitting a target is pretending that you're going to hit it right to the day before it's sort of, you know, the end point. And that's where the forecast. So I think the forecasting is an all-important thing for reputational management of the organisation, and I think that's something we should take an interest in.
So do we have some forecasting work? Yes, we did, and that sat behind the way that I and colleagues reported to the board at the last meeting. So to both of your points, I think what we were projecting is an 8% and 6% underperformance at September 2016 in both adult social care and primary medical services. And expressed a different way, that would mean instead of completing the programme at the end of September, the programmes will be completed between 6 and 8 weeks later, so the end of mid-October and probably into November. So that's what that means. Some of the improvements that are in these charts, though, on page 16 and onwards, not on the charts themselves, but in the tables underneath, are showing improvements in productivity, which I think are the two things that both Andrea and Steve spoke about, and that's the point about systems improvements. So I think what we've been doing, to your point, Anna, is we are saying there is a risk to improving those targets, but we're 11 months out from next September, so to say with confidence we're either going to hit it or we're either going to miss it is the language I used last month and I use again this month, is there is a risk that we will miss that target. Work is underway, which is why it was important that we spent some time going through what is the mitigating action that's in place. I think Andrea was saying that people are working hard to achieve this. I think colleagues throughout the organisation have got the point that you're making, Anna, about we want to do a good job. People care about what they're doing. They've got pride in what they're doing, and they want to do a good job. So I think the secret to this is to tap into that energy, which is not about hitting a target, but is about doing a good job in the right way. The other thing we don't want to happen is we don't want the quality of our reports to start suffering, and we're desperate not to start avoiding taking enforcement action, because actually taking enforcement action means more time. So the balance is between morale and actually completing it, but it's also doing it to the standard that we think this work should be undertaken to, and doing the enforcement, because I think the bigger hit to the reputation is not whether we get there by the end of September or the middle of October, quite frankly, but if the quality of what we do begins to suffer in any way, shape or form, or, and I think this is why I briefly touched on the risk register in presenting the report, that we actually go into somewhere, we think it's okay, we miss something that is subsequently found to be less than, it's suboptimal. And then we're back into this debate about, well, you've been in and you said it was okay, you've missed it. And there was something that we missed because we were chasing a target rather than doing the job in the most appropriate way. So I think what we're doing very clearly and very transparently is flagging a risk to the completion in adult social care and primary medical services of that, of hitting the target by the end of September. But I think we're also saying as an organisation, as a leadership team, not just the senior leadership team, but the wider leadership team, we're focused on working to mitigate the risks that we'll miss that. But we're not going to try and do this in a way that actually allows the quality of what we're doing to suffer, or the fact that we don't take enforcement action.
So can I just, I mean, I completely agree with you about quality. I think that's hugely important, and that's why I think reforecasting is also important, because, you know, there are very good reasons for reforecasting. The thing about reforecasting in financial context is usually there is a kind of pattern for reforecasting. That you know, a formal pattern which organisations adopt. So I guess my question in relation to this is, when is the point when we should expect to discuss whether we need to reforecast the targets in relation to the next 11 months? Because I think that's the next significant moment for us.
So, and I'm quite happy to take a steer from the board in relation to this and to have a discussion about it, but we are looking at what our plans and priorities are for next year. We were in a business planning process, so the logical time to do that for me is as part of that business planning process. So the next couple of months we'll bring to the board the plans and priorities for next year. We get the spending review next week. A few weeks after that, we'll get what our budget allocation is. We'll know what our resources are for 16-17, and that process of matching the resource that we've got available to the organisation and the work that we've got will begin, and we'll set that out as clearly as we possibly can in a business plan, which will come to the board in the early part of 16, with a view to being published in April 17, which will set the priorities, and that will mean that that period from April to September will set out in detail. So I think we'll give a clear and ambiguous statement of what we think we're going to do by September in the business plan, which we'll publish in April. So this next few months will see us review. There's some really, I think, very, very good staff who've done some quite excellent work in Paul's team in relation to forecasting that have allowed us to bring these reports, and their work continues to be front and centre in relation to monitor this and tracking this. We receive as an executive team a weekly report. I was overhearing Andrea speaking to Mike and Steve yesterday about just how the quality of that data has transformed the ability to have a conversation about where we're up to, because we've now got this in real time down to team level. So it allows a management conversation to take place about performance, which has not been possible hitherto. Now that's been available for 3-4 months in the quality that it's been coming through. So I feel we're in a much stronger place, but I really don't want to be a hostage to fortune of saying we're going to hit it or we're not going to hit it when there is a risk that we're not going to hit it. I think we should be clear about that, mitigate the risk, but also be realistic with you, because we are trying to balance morale and delivery. The key point in this is we're not going to not investigate areas that we're concerned about, and that's the issue about being respondent to concerns and safeguarding alerts that come through, which is why I made the point about that review we've done of safeguarding earlier in the year being hugely important, and actually get into those concerns that come through. None of us in the executive team want to be here. I think we're just clear about this. I certainly don't want to be here. I'd much rather be having a conversation with you about we're achieving what we've set out to do. But the reality is we're not there. And the organisation is working incredibly, incredibly hard. In the staff survey, we put great reliance on it. When Mike goes into hospitals, great reliance on the staff survey. And I think we've got to give equal reliance on our own staff survey and what our staff are telling us through the staff survey. So that's a balance, I think, that we're trying to strike, and our energies are focused on mitigating the risk and actually trying to ensure that we can support staff to do the job we're asking them to do. But it'll be tight.
Paul.
It's probably just, the timetable you've outlined is probably just about right. So I think it's sort of in March or April, being able to be more definitive would be the right sort of time. And what we're balancing is your point, a crucial point about staff morale and also public reputation. And the earlier we can say it's better for it's better for public reputation, because then you're preparing we know what we're doing. Even if we're not hitting the target, we're saying we know what we're doing. But it's probably worse for staff morale, because then people think, and their shoulders slump. And judging that, I think 6 months beforehand is probably when we'll have the most information to be able to make that judgment.
Thank you. Are there any other comments?
Can I just make a comment about the use of the word reputation, because it sort of worries me slightly, because I think that the key thing, and David, I think, emphasised this, the key thing is the confidence that people can have in us and the job that we're doing, because we need to be doing the job well. So it's sort of, reputation sometimes sounds, and I'm sure this was not meant by members around the table, sounds a bit self-serving, but actually it's not about that. It's actually about making sure that people continue to have confidence, and that confidence can grow in our ability to do what we say that we're going to do, but to do it in a way that absolutely protects the public in circumstances where they need that protection. And I just think that there's a balance in terms of the way that we talk about it.
So I use that word, and I use it absolutely in the sense that you mean, because what I think is really important is that if people want to throw brickbats at the organisation for failing to hit a target, we can be very clear that we knew that was happening, that we took what action we could, but not action that was inappropriate, and so people can continue to have confidence in this. And that for me, is managing our reputation, because that's doing the right things for the right reasons, and I just want us to be in that place.
And just to say, as someone who's set a lot of targets in their time, and has spent, I've got grey hair because of worrying about missing them at a national level, that actually the discussion we've just had is the discussion you want a board to be having about targets and reality, which is they're important, but they're not so important that you'd mess up what you're meant to be doing. But they are important because we said we'd do it. And I think that, if we could be assured that all over the country people are looking at targets in this particular way, I think it will be pretty good, because we're not saying, we're not going to meet it, it doesn't matter. If we don't meet it, it will still matter. But actually what matters more is actually ensuring that the public believe what we're saying about good and bad care.
Thank you. Just on a comment from me on meeting the targets, it's really about productivity. I think having this single number for each of the directorates is not particularly helpful. It's very difficult to know what 0.9 actually means. I don't know, for example, if the role of the lead inspector is so important that our real capacity problem is lead inspector time, which means we end up with relatively low utilisation of other inspectors, because, as I say, the bottleneck is the lead inspector. So I think it might be helpful at the next board meeting to get a better sense of what we really mean by productivity, and also perhaps a sense of, let's assume we have a productivity number of one inspection a month. What does that actually mean? Does that mean a lead inspector can only do one, or does it mean perhaps the lead inspector only does one inspection every 2 months? what are they spending, how much of the time is actually spent on writing reports and reacting to factual accuracy comments by providers. What's really, I think, a better sense of the activity of our inspectors, I think, would be very helpful for, well, certainly for the non-executives, probably quite helpful for the whole board. If we can now go to page 12, and I'm taking advantage of the fact that we're not going over to the customer service centre to have a little bit more time on our report. And page 12 is also a confidence type of measure, which is the length of time a provider has not met one or more of the standards. And if on page 12, the amount of red, which is the over 12 months, is going up at every one of these reporting intervals. So perhaps again we can now go in, as it were, reverse order and ask Andrea, what really lies behind what on the face of it looks like close to 10% of locations having been non-compliant for over 12 months on some standard
Thank you. Again, and I'll probably kind of steal certainly some of Steve's thunder and maybe some of Mike's as well, because some of the issues that are reflected in these charts are common to us. One of the issues is that we do have some concerns about what the data is actually telling us. So there are some difficulties with we're measuring two things here. What we said was non-compliant under our old methodology, and now we're obviously going back and saying that services are good, outstanding, requires improvement or inadequate. And there's a quirk, which I frankly don't quite understand, but there's a quirk that if we've rated services as good, it doesn't take the non-compliance out of the system, and we're going back into that to see how we can correct that. But it has to be done manually, and teams in Paul's directorate and my particular fabulous team with Ellie Casson and the rest are looking at that to see how we can address that. There are also some dormant services that are in this list, and we've been doing some particular work in adult social care looking at the dormant services, and this will have affected some of those that were non-compliant as well, which is that they're not actually continuing to deliver the activity, but they've not actually deregistered, and we've not deregistered them because there hasn't been the need to do that. So we've been going through a process of work of identifying whether those services which we've kind of quote unquote called dormant really have ceased to exist and we should be deregistering and taking them off, or whether they are expecting to be active and actually sort of getting them back into the system. So there's a lot of work going on to kind of really get us to focus on those areas. So the second thing to say is that this is identifying services that are non-compliant over a period of time, but it may well be, and it certainly is for some of the services, that we went in and we said that they were non-compliant in a particular area, and we've gone back and they have addressed that compliance problem, but they've ended up with a non-compliant area elsewhere. And this, I think, is one of the benefits of our new system of saying it requires improvement or inadequate, as opposed to the individual regulatory compliance and non-compliance, because we're taking a look at the service as a whole. And actually the fact that people bump between different regulations in not being compliant is indicative of a service overall that requires improvement or is inadequate and needs action across the whole picture, rather than what I think that behaviour that I think that we were enabling or facilitating before, which was that people focused on dealing with the specific non-compliance that we'd identified, took their eye off the ball somewhere else, and didn't address that. And so one of the areas that we're particularly looking at from that point of view is the question of whether the service is well led, because basically a service that's got good management, good leadership, should be looking at the picture across the board and actually addressing those problems. So kind of taking those two sort of contextual factors into account, what then are we doing? We are, particularly in adult social care, because we've got so many services that we've got to get through in the comprehensive programme, and going back to them to check on their non-compliance. We know that some have indeed improved, but some are not. We're scheduling those inspections, but we're particularly focusing in terms of prioritising inspections on our kind of three major risk factors: that they had a breach, that they don't have a registered manager in post, and they haven't been inspected within the last 12 months. And it's that combination of those three factors is the absolute red trigger, which would mean that we would be scheduling an inspection more quickly to get us back in to monitor compliance. And last but not least is the kind of action that we are taking in response to these areas. The first being our normal enforcement action with regards to the notices that we're giving, and proposals to restrict admissions and all of those sorts of things, and making sure that we are taking appropriate and proportionate action in response to that. But special measures may well also help us, and that obviously only came into force for adult social care from the 1st of April this year, which is to say that we would be going back to services that we had rated as inadequate within 6 months, and if they were still inadequate, setting them on the trajectory to potential deregistration of that service. And sometimes, frankly, we're doing it an awful lot quicker than that. But that will, that kind of very clear timescale that we've now introduced will hopefully force different behaviours from providers in terms of responding to the actions and the problems that we're identifying.
Thank you, Andrea. Just one comment from me before we go around the table. I think that these two issues of our performance against target on inspections and the page 12 numbers about whether providers improve are so important to us for exactly the confidence issues that Andrea raised just now, that without wanting to have more data, although I've suggested we understand productivity a bit more, I think with page 12 we also probably need to perhaps rethink, as well as clearing up the data, cleansing the data, as Andrea said, rethinking how we present this, because I perhaps misread this as thinking that if one takes adult social care, that the providers had been in breach of the same standard for more than 12 months. But I think what Andrea is saying is that that may not be the case. There's also the issue in the text where it says of the, effectively 2,000 locations over 1 year, 577 have an inspection scheduled in the next 12 months. Well, given that they've been in breach for 12 months, this actually means it could be up to 2 years that this, I think it means it could be up to 2 years that the non-compliance has existed for, depending on, when over the next 12 months they're inspected. But I think the first step is to get a sort of more granular understanding of this data, because I think it is very important for this board and for the public to understand, and this after all is that the title of page 12, do we take effective action when providers do not improve quickly? So this is such an important point for us. I think we could do with sort of a version of page 12, which, as well as cleansing the data, actually gives us more insight into what's going on here.
Michael, can I clarify one of the points you made?
Yeah.
We'll absolutely take that away. To confirm this is any breach of any regulations. Often it will be an individual fundamental standard that continues to be breached, but we have done quite a lot of analysis and showed that in all the different sectors, it is usually significantly more than one standard that has been breached in that timescale. There's a certain amount of one is put right, another comes up, as has been said. The point about the inspections that are planned over the next month is to be clear about it. It's 577 where an inspection is scheduled in the next 12 months, as well as it's been inspected in the last 12 months. There's, as it says, there's another 714 where it is scheduled in the next 12 months, another 478 where something has been inspected in the last 12 months. It's only, I believe, 137 where we currently don't have an inspection planned and haven't inspected them in the last, I haven't had a recent inspection. So some of this is trying to put a lot on a single page, and we definitely will keep iterating and improving the performance report, but I think those are the basic facts.
Yes, I just think, even though it may mean 2 pages or 3 pages, this is such an important part of our role that I think it deserves the granularity that the additional granularity.
Could I just mention one other thing, sort of, Michael, which I forgot, which we do now start to need to start comparing this page as well with the page that says when we've been back to services and re-inspected them when they were inadequate and requires improvement, what improvement has there been in that? And there's an earlier slide which demonstrates that there has been, not in all cases, but there has been an improvement in some areas. So it's, I think you're right, tying these things together will give us a fuller picture.
No, I think that's right, although I think the earlier chart showed that 44% of re-inspections result in an improved rating. I mean, of course, if one looks at this from the other direction, it means, over 50% of inspected providers have not improved since the inspection. So I think Andrew's point is a very good one, but both sides of this number are important to understand. Steve.
Thanks. So we, I take this particularly seriously. If you look at the numbers on the chart for primary care, so the graph looks as though it's going up dramatically. But if you look at adult social care, where there are 25,000 locations and the figure is 1,906, if you look at our graph, it's actually 163 out of 20,000. So when you look, I'm into pictures, so if you look at pictures, it looks as though this is worsening and it's a big chart. But actually, as a percentage of 20,000 locations, it's tiny, but they're very important. And I can tell you about every single one of those 174 as of yesterday, because I get a weekly update on it. So as of yesterday, we had 174 on that chart. And just for future reference, if you look at the yellow on the chart, those numbers are increasing because of special measures. So those are the ones between 6 and 9 months. And because we're focusing on GP. And as I said earlier on today, primary medical services here include dental inspections. We only do 10% of dentists each year. And that's one of my concerns about data and risk, and we have to keep on top of that, but it also includes a number of independent doctors on this list. So of our 174 as of yesterday morning, we've only really got 100, because as Andrea said, there are issues about how the data's recorded, and when 10 of those extra ones are deregistered or closed, but they still show up on the system. There are anomalies in the system, which why I support, Michael, your quest for granularity. I don't know how you do that over thousands. 60 are, because I find it difficult over 170 odd, 60 are compliant, but actually as they're recorded in the CRM database, it doesn't come out like that. You see what I mean? So we know exactly what's happening. 44 have plans inspections on CRM, but all of the others are in our risk management that are covered on our regional meetings. So we know exactly what's happening with them all. And there is a process in place in order to tackle these. And with the special measures regime, that focuses things in a slightly different way as well. So I think we're on top of it. If you go back in the board papers to 18 months ago, our chart was in the opposite direction, but showed much larger numbers as it came down. So it's how the data is portrayed, I think, is one of the issues. And I think we're all three of us take this very seriously.
Thank you, Mike. There's in the text, there's a slightly confused sentence about hospitals, which I didn't quite understand, but...
So, let me tell you about hospitals. Our 320, again, we take this extremely seriously, but what I think we need to do is to have a better sub-classification, the granularity you're asking for. Whether the same granularity will work across directorates, I think, is something that we need to discuss and to discuss with Paul. Certainly in terms of my directorate, what I have been asking the director manager and through her to the heads of inspection is to classify these as: have we re-inspected and the original non-compliance persists? Secondly, have we re-inspected but it's something new? Thirdly, we haven't re-inspected but we know we're going to within the next, let's say, 3 months, or we've not yet got it on a schedule, or is it something else? And which is actually the deregistration point that Andrea, we've got a handful in that category. And we've already got a sample using this classification that I've literally got through this morning. And the majority are that they are still non-compliant. Or that there is a new non-compliance. But there are some where we know what's going on in that trust. We have done an inspection. We haven't had the capacity yet to go back. But in many of these, the non-compliance is not of the greatest worry to us. There are other things that are of greater worry, like the trust we haven't yet been to. So we're keeping a watch, and we know that we will go back to those. And some of those we know extremely well because they're in special measures. So I think it is a question of having this at a much more granular level, and I would suggest that we could all work with Paul to come out with to see whether we can have something that works cross directorates or whether it should be directorate specific.
Paul.
Yeah, there's a lot of detail under this. This is always the way, isn't it? We have to work out what you want to show in a board report. We also need, I think, probably work out what we want to show on a monthly or quarterly, or when we want to deep dive into each and every one of them. I think that the thing that comes out clearly, I hope, is for each of the chief inspectors and for Ian and myself, and David, this is a big deal, and we're trying to keep on top of it. I'm very happy to bring more granularity as we needed to the board.
I think, for example, Mike's suggestion is, or the granularity he was mentioning, I think, is the kind of thing, I think, which would be very helpful to the board. Robert?
Just a point which may be my understanding, but I think Mike just touched on it, which potentially is sort of relevant in the room. The percentages, as I understand it, are given here are the percentages of shown on this chart as against the number of registered providers. What I wonder whether that doesn't reflect, therefore, is, bearing in mind the other chart about what we've inspected and what we haven't, is actually what we're talking about here, surely is a percentage of those we have inspected and know about. But Mike's point, I think, seems to be a very strong one, which is that we also need to take into account a concern about those we haven't even been to, or under the new regime at least, haven't been to. And therefore, concerning though some of this might be, at least we know what we know, but we also need to factor in there's a lot out there that we don't know, and so that we need to have a balance between dealing with what we know, because we can evaluate that, and actually getting on with finding out what we don't know. And I just wonder, therefore, if the percent, but equally the percentage, if you translate these red figures into a percentage of those places which have been inspected, we're not talking about 7.5%, we're talking about over 50%, aren't we?
We are, though. The non-compliance, the breaches don't just relate to our new approach inspections. Many of them date back to our old approach as well. But the point is absolutely right, that we have particular concerns where we haven't been in under our new approach, so there may well be things that we will uncover as we do that.
Good. Any further comments?
Generally on the report? Or?
Yes.
Yes, this is sort of links a bit with what we've just been talking about, and this is on the risk register, the fourth risk down, that we do not have an impact and are unable to encourage improvement. In July, the NHS set up a new organisation called NHS Improvement, which one hopes is going to assist us in this. And they've now got a chief executive and a chair, and I think we should have an early board-to-board with them. And they will say, no, wait until we sort it ourselves out, and we need to say, no, we need to be part of that sorting out. Because if they can form themselves in such a way as not work with us, and that would be really unfortunate, or they could form themselves in such a way as to be an integral part of meeting this risk. So I think in the new year, I think it would be very good to have a board-to-board.
I'll take that forward, Michael. If it's any consolation, Paul, we've had early conversations with the new chief executive. Mike and I were just talking about it again this morning, and I've had 2 or 3 meetings with Ed Smith, who's the new chair, where this issue about the nature of our relationship and how we work together is critical. So much of these are down to personal relationships, and with David and David Florey having moved on and those changes taking place, we've got new personal relationships to establish. But there will be changes in NHS Improvement. They'll bring forward their new structure by the end of this calendar year. So they've got changes to make to create a single organisation from those 2 organisations. So there's going to be further people developments, I think, in that organisation that we'll need to do. So if we take that away, and I'll make the suggestion to both to Jim and to Ed Smith, and I'm sure they'll be happy to do that, Michael. So, yeah.
Sorry, 2 other points. Paul, could you just take us to page 26, which is where we stand against the business plan deliverables, the RAG rating?
Would you like me to go through each of them, Michael? How do you want me to do this?
Well, I think if you just give us a sense of how far we are, how close we are to meeting. We've talked earlier about the actual inspection target itself, but how close we are to meeting especially as we're going to be discussing the new business plan later. Just generally how we're performing against this year's plan.
Yeah, happy to. So you have the overall picture against each of the commitments in the business plan and the 4 sections of it on page 26, and then for the particularly high priority change projects, there's a bit of commentary on page 27, and on specific deliverables that are amber red, further commentary on page 28. So I won't try and go through all that detail, obviously, in the board meeting. I think the summary is that it is it's quite a spread from all the ones that are actually looking pretty green at the moment, for example, revising our policies on safeguarding, as David mentioned, all the way through to ones that have a good degree of red in them. I don't think we have any that are hard reds, but there are a number that are amber red, and that's why we break out in the subsequent pages what the details of those are. It's probably worth doing two more things as a sort of summary. The first is to say that of the four components of the current business plan, to sort of remind the board, there's two that are particularly outward-facing, and that's delivering the new approach to regulation and shaping the future. And then there's two which are sort of colour-coded in blue, priorities 3 and 4, which are supporting that, but they are effectively more internal. They're about building better CQC and making sure we can show the difference that we're making. And the reason I highlight that is that the performance is slightly different across those four. So in terms of delivering the new approach to regulation, we've had the discussion about the inspection trajectories, but broadly we are happy about the way in which we are embedding that new approach. You can see there's a lot of green and amber green on the first section. Shaping the future as well, we're confident in the work that we're doing on the work across individual places, which is Greater Manchester, elements of it, and North Lincolnshire, and we're broadly comfortable with the way we're rolling out the strategy. We published the Building on Strong Foundations signposting document a fortnight or so ago. The area of concern there we have, which is largely because of the state that it's, status it has and the stage of development, is in our work on use of resources. There are a lot of dependencies for that piece of work, not least the important work that Lord Carter is doing. And while we get clear on how that work is received in the NHS and the metrics that are being used, because we want to use a heavily intelligence-driven approach to use of resources, we think it's prudent to take that one as amber red. If we move on to building effective CQC and demonstrating the difference, and there may be ones that Eileen wants to comment on as well, I think the overall point here is that there are a number of things that are going well, the way in which we're embedding the values, for example. And we've made a lot of progress around the way in which we monitor services. We're moving from a focus on quantitative data and intelligent monitoring to having a more encompassing, comprehensive surveillance that we call CQC Insight, which we're rolling out for the new financial year. But I think we've always said that as we spent the last 2.5 years of transforming the organisation, we put a particular emphasis on getting going, starting the ratings programme, getting the assessment frameworks and the methodologies right. I think that was right, but there is the corollary to that is that it's relied a lot on individuals to work hard, do the right things, not always with the support of the processes and systems. So we are playing catch-up on that, and that is reflected in the staff survey. That's why, again, we rate a number of these things as amber red. For example, our work on the knowledge and information strategy and on the operating model, but we have a big programme of work underway and would hope to be showing those coming through as greener over time. The final one, just on experts by experience. We had some conversation about whether to put this as amber red or amber green, because at the time when we were putting this together, we didn't quite have the sign-off we were looking for from the Department of Health. We now absolutely do have the sign-off on the experts by experience programme. So it's a complex programme, it's a large contract, but that is definitely heading in the right direction. So it's a bit of a whistle-stop, so I don't know if anyone wants to add anything.
Just a couple of very minor points. I think in terms of the academy, we've made reference already to the importance of equipping our staff with the skills to do the job, and very good progress has been made on that. We've now been able to appoint our provider of leadership and management development training, which is a key priority, again now as we move to really embed the way that we work. So that has been progress really in the last few weeks, where I think we can say that we are internally building on some very strong foundations now. And around embedding values and the amber green there, I think the staff survey shows that we've got really good staff recognition of our values, but actually what we know we need to do more about is actually linking those through to behaviours and culture change. So I wouldn't want people to think that we're complacent on values. What we're doing is acknowledging the recognition that our staff have of them. We want to do a lot more to actually build on those and the changes that they actually represent.
Any comments? Well, I think it's been very useful for us to have a much more thorough look at the performance report, because it is such a crucial document, because it really does give, I think, certainly the non-executives, but I think obviously the whole board, a really good insight into what the CQC is doing, how well it's doing it, what our issues are. So I think it's been worth the additional time. So is there any other business or questions from the... In that case, I think we can call the meeting to an end, and if we could have a restart at 10:45, I think that would be very helpful. So thank you very much.